Hello, I'm Rafael Mazuz with Diligence Wound Care Global. We're here wrapping up SAWC Spring 2019. And we're here with Piette and Joe Ebberwein from Corstrata. Corstrata is a really interesting company that we've been following for a while. We're going to get into their business model, who they serve. But you know, most of the companies here are products-focused companies, and that's like most wound care conferences. But actually, the wound care services market is between 5 and 15 times, depending on how you define it, the size of the products market. Yet there are fewer companies in it, and for sure, fewer large players. They're smaller and medium-sized companies. So it's a real big opportunity both for investors, for executives, and even the product companies, I think, are trying to diversify more into services, whether that's educational services, outcome services, data services. They have their own ways of doing it, but I think Corstrata is one we wanted to share with you because they have a really neat approach. So thanks for joining us.
Thank you, Rob.
Thank you, Rob.
Wonderful.
Great to be here.
So Kathy, why don't you tell us in a nutshell, what's Corstrata, what's the need that you fix, and how did it come about?
So Joe and I both come out of the home health and hospice space. While we were there, we were early adopters of remote patient monitoring. We understood the value that technology could bring in terms of cost savings and increased in quality. We wanted to tackle a problem in the post-acute space that could be solved with technology. So almost 4 years ago, we launched Corstrata in order to utilize technology to bring access to board-certified wound care nurses. There is a dire lack of access to those resources in the post-acute space. In fact, only 10% of all board-certified wound care nurses operate in the post-acute. And we realized this was an opportunity to introduce both cost efficiencies and better care into that particular vertical.
So you're using technology, but this is different than people looking at the telemedicine codes. You know, I did a consult for $50, $70. And because a lot of the people are saying, well, telemedicine's the future, but right now it's still more lucrative, for lack of a better word, or more profitable to do a face-to-face visit than a telemed. But you've actually gone a separate way in terms of your business model. Maybe you can talk about that.
Yeah, so we work with companies that really are on the edge of value-based care. So for instance, home health agencies are paid a capitated rate. So they're managing to a certain dollar amount, and all of that's changing with new reimbursement with PDGM coming in 2020 to home health, and wounds are become a major focus for them with clinical groupings. But if we can go into an agency, some that have been looking for a wound care nurse for over a year, or they can't keep them, we're a much more effective and efficient model. We work with the staff at the agency. They're able to basically use our technology in the home to photograph the wound. We're able to introduce evidence-based treatment protocols for them to heal the wound faster at a lower cost.
So what platform are you using to connect the patient and the clinician with your board-certified experts?
So we used a couple of different technology, but we use tissue analytics for our wound imaging analysis and documentation platform. We use a company called Citus Health for our patient engagement and telemedicine video, HIPAA compliant, and we're able to engage with providers or patients directly.
So you can get the objective measurement and imaging, but you can also interact in a video and do it at that level.
That's correct.
Exactly. And it's really multi-channel communication, so we can also push educational PDFs, videos. We can text and actually use the Plano telephone if absolutely necessary.
So our value to the provider, for instance, a home health company who may be doing upwards of 25 to 30 visits per episode on a wound patient, they're still getting daily dressing change orders from physicians. We can work with them to really introduce advanced dressings that extend wear time and reduce their visits per episode.
Okay, so let's get into the business model a little bit deeper on that point. It's a subscription-based service typically, right?
Correct.
Okay, so and that's going to be a fraction of what it would cost to have a WOCN full-time.
Absolutely.
Right, okay, beautiful. So saving money for these small, anyone with small to mid, but even large,
Exactly.
that either they can't have a WOCN or they can have 2, but they should have 10 for the number of patients they're seeing.
That's right.
But they're not going to have 10,
That's
so
right.
they can have you.
Yes.
And so you can help them save money. How much does it cost, or how much does a home health agency, for example, get paid for a typical period of wound care in the home?
Right.
On
so
average?
On average, it's about $3,000 per 60-day episode.
$3,000 per 60 days. Okay.
Yeah. Now, with the new reimbursement, some analysis has shown that could potentially go up by about $500 per episode. So it's a significant wound clinical group.
And so on average, of course, it depends. If they have 10 wounds or a little wounds, but how much does it cost for them to send a nurse to the home within that $3,000 to $3,500?
Right.
Car, gas, salary, supplies that they have in their trunk, and other overhead. What would they peg that the cost would be?
Yeah, typically that's about $150 per visit in the home. So if they're doing 5 visits a week, and we can cut that down to 2 and sometimes even 1 visit a week, depending on the dressing type, then it's significant savings for them.
So 20 visits in that 60 days is at about $3,000 on average. So if they were going to be 24 visits, but your expertise got it down to 18, there's their profit versus loss.
Absolutely.
That's exactly
Beautiful.
right.
Yep.
Now, is there anything you can do for them on the revenue side? That's kind of saving expenses.
Well, we can actually set them up to be their own wound center of excellence. Mm-hmm. So with the coming changes in PDGM, they need to efficiently manage those wound care patients and start taking those rather than avoiding them. So they actually need our services in order to set themselves apart from their competition and really start capturing those wound patients.
And with coding, with the changes coming with PDGM, it's going to be imperative that they code accurately, that they identify the etiology, the adequate, the correct staging of pressure injuries. Yep. So all of that plays into our assessment.
And that affects the bundle of money they get for the 60 days, usually,
correct,
right?
Exactly
So,
right.
so if they were going to if they thought it was a stage 2 pressure ulcer, and you said, you explained to them why that could be a stage 3 based on the photo and the documentation, that could actually raise the bucket that they have for that 60 days.
That's exactly right.
And the other issue is that home health agencies are being judged on the quality measure of new or worsening pressure ulcers. Mm-hmm. So let's say your admission nurse goes in, and an admission she does identify that as a stage 2 pressure ulcer, but your discharge nurse comes in and discharges as a 3. So you've been dinged.
Yeah.
Exactly.
So you can help as almost like an audit of that.
Yeah.
Now, to be clear, all the clinical suggestions and reimbursement or coding, these are suggestions. So you don't have to worry about being licensed in the state and being a provider. I don't know. I'm asking, but it's like a lot of docs are putting in nurses on LinkedIn. They just put a picture of a patient. What do you think I should do?
Right.
Anyone can say what they think. It doesn't mean that they become the provider. So in that sense, is that correct to say that you're not really providing, you're just consulting?
So we are a consultative model. We do license our nurses in the state where the patient resides. So we've got all of that covered from a licensure standpoint.
But at the end of the day, it's the clinician and physically there who's making the decision whether it's a product or whether they should change their documentation.
Right, and what we do is we make the recommendation and then they follow up to obtain the physician order. Exactly.
So I like that a lot because a lot of the challenges are with telemed, the reimbursement, not catching up, but you don't have to worry about these codes.
That's correct.
And the licensure, and where's the provider, and where's the patient, and what the and does the provider giving you the telemed consult, are they covered by the insurance? You guys are kind of going a bit higher level than that.
Exactly.
You're helping the patient, helping the provider, but you're not getting into the nitty-gritty of becoming a person in that billing chain.
That's exactly right.
Exactly right. So we are not a provider, and we are not billing commercial insurance, Medicare, or Medicaid.
I like that. I think you've kind of gotten around one of the big barriers to telemedicine in general without having to dilute the value that you're adding. Now, without getting into specific product brands or names, because that could be a whole other conversation, but help me understand, help our viewers understand, what types of advice about products would you be given? In other words, you're not being subsidized by product companies, you're just trying to give good advice.
Right.
What were some of the considerations you might help them with, and what might be the outcome financially and clinically?
Absolutely. Many of these agencies we go into, and we look at their formulary before we begin doing virtual consults. And we want to narrow that formulary, get it tight. We recommend very few brand products. We like to be brand neutral. We work with any of their distributors, and we provide that tight formulary. But what we also do is add some advanced dressings. And what we find out there right now is that there are many agencies using lower cost dressings because of the price point, and not really thinking through the fact that they could extend the time between dressing changes by using a more advanced product, and thus save them the expense of the visits.
That's a great point. So here, they're wrapping up the Congress now. They're starting to pack up, but you walk around and the reps and the booths, they say we absorb this much % more moisture, we kill this much more infection, and it's true. I mean, there's nothing wrong about that, but that's a long way from practically guiding the decision making of the less specialized care sites that, first of all, are often not at these congresses getting the education.
That's right.
And second of all, you're putting it into practice instead of just having that disconnect.
So actually, we're finding that 30% of the time, home health agencies are misidentifying the etiology of the wound. And we know that if we haven't properly identified that etiology, we're not going to be driving the evidence-based care treatment.
Sure.
So it's I think that's the first point of value that we bring, is to properly identify that wound and set it on a proper treatment plan with an advanced dressing that will extend wear times.
Wonderful. And so you're currently in fundraising mode right now. You're looking to expand the program. What are you going to be using those investments for?
Great question.
Yeah, so we are looking to really expand our reach. We're currently in 10 states. We're licensed for 34 states, but by the end of the year, our roadmap, we want to be in all 50 states and have access and availability in those states. So our use of funds will be used on marketing and sales. We're also refining our data analytics platform so that we can really start to look at more predictive and prescriptive modeling when it comes to the data and the wound types. We're collecting a lot of data around product. So in the end, it's outcomes, right? So we're looking to expand our ability to measure those outcomes. So
beautiful. I love it. So early stage, but having some good solid revenues, good solid growth, and instead of so many companies that are sitting around saying, we'll get digital when digital comes, when the reimbursement comes, you've built a model that's viable now, that's getting to potentially 50% or more of the patients that don't have advanced wound care centers with everybody focused on advanced wound care.
Correct.
Reimbursement you've solved, and the platform, if there are tweaks and changes to reimbursement, in this case it's going up, if it goes down, if it goes left, if it goes right.
That's right.
You have the infrastructure. It's not a problem to tweak your platform over the years. So I really like that. I think the product companies are interested, there's healthcare systems and services, and then of course as you gain the data, the payers will be, and they'll just go directly to you if they'd like. So I really like that model.
Yep.
So hopefully, thank you for the time, and hopefully this was educational and illustrative to some of the investors and executives out there, how you can be more than a hospital and a clinic or a nursing home or a home health or a product manufacturer and marketer. There are opportunities that kind of bridge the gap in this space, probably the fastest growing space in healthcare, and we just have to kind of think outside of the box, and I think Corstrata and companies like you, very few, but companies like Corstrata are doing that. So thank you so much.
Thank you
very much.
Appreciate the opportunity.
Thank you so much.
Thank you.